When coronavirus first knocked on the global gate in late 2019 from its city of origin, Wuhan in China, Kenya was not spared. March 13th, 2020, the country recorded its first case of the virus.
The case is a Kenyan citizen who traveled back to Nairobi, returning from the United States of America.
From the health crisis came the economic catastrophe. Lockdown measures imposed the first few months of the pandemic massively impacted many sectors like livestock markets, small-scale enterprises and agriculture. And for the better part of the year, Kenya went through a series of crises from partial lockdown, dusk to dawn curfew and loss of jobs, among others. Stakeholders immediately turned to the process of preparing how best to respond to the unprecedented disease.
So around February then is the same time when we're doing the multi-hazard. As a Kenya Red Cross, we coordinated the 5-day multi-hazard review of the plans for the other year to fit into this year, and it's the first time that we systemize it to be part of the Kenya Red Cross. And so apart from the normal traditional emergencies, we have the floods, the conflicts, the outbreaks within the country. So we had COVID also as part of that multi-hazard plan for this year.
Also started to preposition some materials in our field offices just to ensure that if we needed to respond, then we had at least some basic things. So it actually happened that on the last day of our second batch of training was the day that the Ministry of Health announced the first case in Kenya. So for us then it was really timely and we were really ready to roll out immediately. So I would say we have been supporting the Ministry of Health from the beginning of the pandemic in Kenya to date.
As the virus kept impacting Kenyans in different dimensions, from health, social and economic fabrics, a lot of stigma kept people out of healthcare systems as communities shied away from vital services like child immunization and maternal health for associating healthcare workers and facilities with the virus.
What we've done is to be able to think with the other partners like the county government. And for example, what we're doing within the Nairobi Metropolitan is we've adopted the outreach approach. So within the outreaches, and especially if you can assure the community that the outreach environment is safe enough, and safe enough means a lot of aeration. So most of our outreaches are in open air. So you actually find that people are sitting outside, they're queuing outside, maintaining the social distance that is expected. We've actually had more and more clients coming in for the regular services.
Sasa wakatutembelea, wakatuonyesha jinsi vile tutapima hawa watoto, ujue mtoto wako anaendeleaje, ako na afya nzuri ama anaendelea vibaya. Ndipo ukimpata anaendelea kama hiyo venye tumeonyesha, anaendelea vibaya, itabidi mpeleke hospitali.
The nation is still battling the monster that required a multi-stakeholder combat from the onset. Partners like Kenya Red Cross had to have a quick turnaround of events for basic case management and safety measures before dispatching its trained team of staff and volunteers to the 47 counties to further train communities through Nyumba Kumi leadership, coordinating with government and other partners to avert further spread of the virus at the community level. The cessation of movement imposed by the president in the first few months, coupled with the night curfew that curtailed lots of late-night businesses, led to an emergency need for food donations to the most vulnerable population in the country. The distribution, however, needed a lot of transparency and proper coordination by the donors and partners. So far, over 500 tons of food have been distributed, translating to more than 30,000 households.
Through concerted efforts, we have been able to register the right beneficiaries. And when we talk about the right beneficiaries here, we are talking about child-headed households. We are talking about the very elderly people who cannot fend for themselves. We are talking about persons living with disability who live in the informal settlements and cannot fend for themselves. We are looking also at widows, single mothers who have kids and cannot fend for themselves. So it's been a very trying moment, and of course us coming up with a very clear inclusion and exclusion criteria has really helped us to get the right beneficiaries.
Kenyans have always been known for their spirit of generosity portrayed during disasters.
Whoever we approached has not said no to us. They've all come on board. We've built up that trust, the trust factor. And they all now know that whatever they donate is going to the right place. And we have converted most of our donors into life members of Red Cross.
Kenya Red Cross Society has also benefited from the support from the EU, European Union, where we managed to deploy a surge team, a team of counselors, doctors, pharmacists, nurses, lab technicians who are working with the county at the isolation team.
In Mombasa County, the partnership and food distribution was done in a very unique way, where technology was used for transparency.
The reality is there was a lot of denial by the people of Coast. Initially there was that clarion call that people should remain at home and very few people should report to work. And now the partnership which came up between the county government, ourselves and the Kenya Red Cross was the issue of a failing food to people so that they can remain at home. And I think that was the turning point.
Nashukuru sana kwa sababu wakati huu wa Covid-19 ni wakati ambapo kuna shida nyingi sana.
Kama kijana sitatoka nje kuhangaika kufukuzana na watu nipate riski. Yaani nashukuru alhamdulillah.
As the cases of infection skyrocketed in Kenya, the issue of mental health became a concern for many. The society's problem management program became a turning point for those who needed help.
And we've been able to support the cascading of about 43 county mental health teams. And that means we train them, we enable like a connectivity. And within our Kenya Red Cross complex, we are running an emergency operations center that is also providing the tele-counseling services across the country. So we've deployed counselors both at the national level and even within the counties to be able to support the county mental health teams.
For a community health volunteer to be a problem management plus helper, they underwent a 5-day training that taught them on strategies that they're actually implementing in the community, having one-on-one sessions with clients that are undergoing adversities.
Nilikuwa na stress mingi sana. Sikuwa naweza kufanya kitu yeyote ile. Lakini kwa sasa kupitia hii PM nimesaidika kabisa. Amenifikisha mpaka kiwango kingine yenye naweza funza mtu mwingine. Ama mimi mwenyewe pia nikienda chini tena naweza ifanya nini? Naweza inuka tena.
Emergency response, may I help you?
This call center here serves the Mombasa population in psychosocial support.
Most of the times, the cases that I get are like people in quarantine who don't understand like why they're there. So they're in so much distress, like they have so many questions that are not answered. So I'm there to offer that mental health and psychosocial support.
When learning institutions were closed, many learners in the informal settlements had to stomach the cost of being home when some families could not provide even a single meal.
But sasa bidii ni hustle, ni sawa kwanza vitabu, juu mzazi hawezi pata kila kitu. Hawezi nipatia kila kitu nataka, na mimi ni msichana, niko na mahitaji zangu kibinafsi, nina mabrother na masista wadogo. Mzazi job yake yuko stable. Sasa nafanya kazi ya kupika bajia.
However, they have been coping through helping hands from well-wishers without necessarily engaging in unwanted activities.
Some girls have indulged in so many other activities because they need to support their parents. And some young boys also, we had a session with the boys, and they've told us they have had to go and engage in robbery. They've been involved in robbery just to get something.
Hii kama msichana siwezi kati nikikosa hizo helps zenye wanatusaidia I'll just end up niharibu tu life yangu. Unaona? Ni end up kama ni drugs nipunguze depression. Kama ni sex, I engage myself in sex because these things hapa nje siku rahisi.
Young people living in slum areas have always been blamed for crime and substance abuse, and staying at home for months meant they needed to be kept busy.
Imenisaidia sana kumanage relationship yangu na familia yangu, imeniokolea sana. Na pia improve sana hii mtaa yetu. Napata hii grau hapa, angu kuja kukutana hapa, akajapigwa na moshi ya bangi hapa. So imetusaidia sana, tumeweza kubonga na mavijana.
Kaa sisi mavijana majioni ukama hapa grau tizi. Unakuta hiyo imetusaidia kuavoid vitu kama drug abuse. Tena hiyo ya mari imefunza mavijana kufungua roho.
Communication is a problem. Because as deaf people, we use lip reading a lot when communicating. But now with the masks, it's hard. So people tell me to remove my mask so that I can communicate, but of course I cannot. So that becomes a challenge. And actually what we learned is this group of people feel ignored and feel neglected, and they have a lot of misconceptions and lack of correct information about corona. So what we've been doing is demystifying the misconception, giving them the correct information.
In northern Kenya, Garissa County is the hardest hit by the pandemic, and the county had to partner with the Kenya Red Cross Society to train 1,000 community health volunteers in all the sub-counties.
In terms of capacity also, we targeted the prisons, some of the high-risk areas, the prisons, the military, the police.
About 107 kilometers away from Garissa town is where some of the most vulnerable population is hosted in the Dadaab refugee complex. As the focal organization in this camp, the society was also mandated with COVID-19 sample collection and the shipment of the same to different facilities under the Dadaab sub-county in partnership with the Ministry of Health and UNHCR.
Our biggest asset is our volunteer network, and this is something we can pride to say that was really the basis of our success, because we are present all over the country in 47 counties. With 47 branches, but more than 200,000 volunteers on ground who are coming from these different areas in the country, which means that in every county we had a group of people that were out there reaching out to communities, including to the farthest hard to reach areas where many others may not have been able to reach. To date, we can say that we have reached almost 27 million Kenyans through different interventions for COVID-19. So for us, this is really a big success that we have also been able to reach different target groups.
First time you get admission.
Dadaab also hosts the biggest COVID-19 isolation facility in Garissa County. The center is located 5 kilometers away from the community. The Jaramogi Oginga Odinga Teaching and Referral Hospital is a very busy facility in Kisumu County.
We don't have enough manpower in this particular place. So when Red Cross came in handy, they gave us support. As you can see, there are some of them managing crowd, some of them are taking temperature, and their reinforcement has enabled us to come this far.
They have really helped us as a country to do health promotion in terms of to the community, basically to the community and to the healthcare workers on COVID-19.
The time when visitors were prohibited from coming to the prisons, then communication between the prisoners and their relatives also became very difficult. So again, Red Cross gratefully supplied us with more than 5 phones. So this one has helped the inmates in getting in touch with their relatives, and also this has helped them in making sure that their court processes are on course. So it has reduced the levels of stress within the inmates.
After our training with the Red Cross,
we put our foot bath. We also got thermoguns from Red Cross, which helps in checking people's temperatures. We also have put washing points, hand washing points in several parts of the prisons.
We found funding from MasterCard Foundation, which help us train healthcare workers on treatment for COVID-19 and also tracing teams for surveillance and contact tracing. We also got funding to train nutritionists to be able to integrate nutrition interventions during the COVID-19 response.
However, the extraordinary COVID-19 journey has presented unmatched challenges to the nation and for the stakeholders like Kenya Red Cross in trying to attend to multiple disasters in the country.
We had floods, we had the desert locust invasion, and the floods in particular were also very challenging because we know we had very bad floods this year. So you can imagine when you have people displaced in camps and you are also trying to ensure that the preventive measures are put in place, it was very difficult because how do you ensure the 1.5 meter spacing in a camp? How do you ensure that people continue to wash their hands all the time? Of course, when we respond to other disasters, there is always a risk in terms of safety and security, but this really was one time we found ourselves quite challenged. So how to ensure that the staff and volunteers stay safe as they respond, but also how to ensure that in case there are any of them that may be found positive, that they are also not going to be the source of transmission to the communities we serve. So that's something that really kept us, really thinking, but also ensuring that we kept, very strict measures on ground to ensure that this does not happen. But of course, we are part of the bigger community, and so we are exposed just like any other community.